Historically, we also work with outside organizations such as the other academic institutions or nonprofits or health research organizations and also for-profit companies. And basically it starts with a simple conversation, thinking about what the study goals are, how to achieve them, sort of a list of tasks at different levels. Maybe it's more senior statistician, a data analyst, data manager, and so forth. Then it's a list of tasks, it's deliverables, timeline, and then once we establish all of that, we have to work with the JHU Research Administration on contracting, because there is a specific contracting for that, which is outside the center. We do facilitate the process. And once the contracting is done, then we can work with the company, then the work really begins.
So for our internal and external clients, most time we help them with their statistical analysis plans. Ideally, they would come to us earlier where we can help them just to decide what kind of research question they're trying to answer and how to better formulate those research questions. And then based on that question, how can they design a study that can answer that question? And then once they have those information, we usually help them with sample size calculation and then have some data collection management plan. And then when they collect the data, we can help them analyze the data, write statistical results, and help them draft their manuscript. So that's one services we provide. And oftentimes also clients come to us about grant proposals. So we work with them to formulate research questions and sample size calculation, and hopefully to help them to get the grant from the funders. The length of a project really depending on the complexity of the research question and also, of course, the data structure. So usually for a large study, it can be like more than a year, but sometimes for a shorter analysis, the turnaround actually could be just within a month.
In the biostatistics consulting program, we're trained to kind of take that whole research life cycle and be able to help somebody out, whether they're just at the inception of their research, whether they've got an ongoing study and maybe they need more support than they'd really envisioned, or if they're at the end of their study, sometimes you're more limited in what you can do there, but still sometimes that can really make a difference. So that's the goal, is to, no matter where somebody is in that research life cycle, be able to help them out.